Good afternoon. I'm introducing myself, Dr. Luisa Cerutti. The first technique with Opera REV. Introducing Opera REV. Opera REV is a pack 1 for 1 ml. Its volume is effect, pH set, needle 30H, 20 mg/ml. Are replacing touch for the face by revitalization the hair, firm, hydrated, and shiny skin, higher production of collagen and elastin, reduction of wrinkles. By stimulation, by revitalization, administer the forerunner endo, the final product hair, regenerate. By revitalization is a medical aesthetic treatment that holds the inject administration of substance responsible of a restructuration action of the face, returning tone and elasticity to the skin tissue, preventing the signs of aging. It exercises target action on hydration, tone, brightness, skin trophy, protection from oxidative stress, from exposure to UV rays. Indication and contraindication. They traded thriller skin, matte gray skin, skin hypotony, laxity of the subcute, skin elastosis, photoaging, chronoaging. Permanency and lactation, autoimmune disease, local skin infection, herpes, acute infection and inflammatory disease, allergies, oncology disease, hemophilin and hemorrhagic disease, cardiovascular disease. But what is advantageous? Intradermic inoculant holes to introduce important quantities of active ingredient. Trauma caused by microinjection causes fibroblastic and neoangiogenic stimulation. Reintegration and revitalization, both quantitative and qualitative of the elements currently. Turgid, elastic, hydration, and brightness. Micro-wells technique. Intradermical microinjections are carried out about 1–2 centimeters apart, creating micro-wells. The advantage of this technique is to be able to use reduced doses of the active ingredient, doses that spread into the tissue, underlying inoculation and persist for longer prolonged effect. Technique BAP, bioaesthetic points, characterized by 5 points that identify 5 anatomically receptive areas of the face, and with the absence of large wells and nerve branch to minimize risk and hold an excellent diffusion of the product in the malaria area and sub-malaria with the aim of obtaining tissue remodeling. Classic technique, micro-wells and 5 BAP points. This is the chemical reaction for inflammation and remodeling for the skin. And this is the fibrogenic process for the synthesis collagen for the fibrosis, the dermal fibers. Fibrosis, type of connective tissue rich in collagen fibers oriented in the direction of the force that exertion of them and arranged or in parallel beams. Fibrosis determines the development of fibrotic connective tissue as a restorative response to injury or damage. Fibrosis may refer to deposit of connective tissue that presents itself as a component of normal healing or the excess deposit of a tissue that presents itself in pathologic treatment. When fibrosis occurs in a response to injury, the derm scarred is used. Fibroblasts, the main cell in the dermis, receive stimuli through receptors, which, depending on the stimulus received and stimulus receptor, modulate a biological response that results in the production of type 1 or 3 collagen. The most important fibroblast receptors are CD44, which can be active by growth factors and biological fragments of the dermal matrix, or by a physical stimulus such as LED light or through transdermical convenience of suitable active ingredients. They can be produced directly by blood centrifugation or through skin microtraumas. Other receptors are CD39 and CD30, stimulated respectively by chemical and physical stimuli, thermal, mechanical, which improve the appearance of the skin. Type 1 collagen fibrotic or scarce tissue makes up 19 pairs of the collagen present in your organism, especially in the skin, where it represents the main structural component of the extracellular matrix of the dermis, with less generate a greater aesthetic effect. Type 3 collagen, reticular or juvenile collagen, is present in the dermis and in the walls of blood vessels. It improves the biological friction, texture, hydration of the skin through a stimulation not only restorative, but above all regenerative dermal regeneration with skin benefit approximately to the naked eyes. Biostimulation group, together a set of aesthetic medicine techniques able to activate and stimulate some physiological process of the skin in order to obtain an aesthetic and a functional improvement of the skin. This method focuses on modulating the activity of dermis fibroblasts, training to stimulate the biosynthesis function involved in collagen synthesis, the construction and optimal physiologic environment, the enhancement of cellular activity, hydration, the synthesis of collagen, elastin, and hyaluronic acid, a better spread of nutrients in the dermis and overlying epidermal layer, better vascularization of the dermis, an improvement in the vitality of the shell component of the dermis and epidermis. Acupuncture, ancient therapeutic practice used in Chinese medicine around 2700 pre-Jesus. The mechanism of action develops an inflammatory action and neurovegetative reflex. It is considered an alternative medicine, which is exercised through the infusion of a smile needle, one specific area of a human body. The intent is to promote health and well-being. It was born from traditional Chinese medicine, and according to some historians, the first attempts date back to 100 pre-Jesus. Only around the 16th century, it arrived in Europe through the discoveries of some Portuguese missionaries who had traveled to the Far East. In the following centuries, the theme of acupuncture was long debated until in 1939, a French diplomat named Georges Sully de Morin published a personal translation of the terms in use in Chinese acupuncture texts and the terms meridian life first, recurrent in the language of modern acupuncture. In 1972, in the United States, in Washington State, D.C., the first legal center for the practice of acupuncture was born. In 2010, UNESCO declared acupuncture a World Cultural Heritage Site. Key points. Disposable still needs specific points on the patient body, health and well-being, meridian axis, energy balance. Needle stimulates specific points that should correct the degenerative imbalance of the body, known precisely as meridian. Needle in acupuncture stimulate the production of energy and the cellular leaven, collagen synthesis, the turgid and tone of the facial musculature, blood and lymphatic circulation, oxygenation of tissue, improve the appearance of wrinkles, the colorful, the skin texture, hydration, the brightness. It's not just about QA energy. Acupuncture of the infusion of needle also stimulates the self-care reaction of the skin. The injury produced by the needle determines the activation of repair process. Circulation is stimulated. Oxygenation. Toxin eliminated faster so as not to hinder the healing process, and fibroblasts stimulated to produce more collagen type 3. The first technique, F full face, high injection, hair regeneration, S skin, T total. Why use the first technique? No danger zone, treatment for the whole face. Anatomic receptive areas where there is a not absence of large wells and nerve range. Superficial subcutaneous dermis injection, purpurose, hydration, brightness, compactness, and a slight tensor effect. Identify 6 acupuncture points that stimulate muscle tone and skin microcirculation through reflect action. Comprehensive bioregeneration treating involving all face district. 1 point, triple header 23. Dear looked above and behind the other hand of the eyebrows. Improve tired, swollen, circled eyes or far-looking draining effect. Biliary street 1, about 1 centimeter sideways from the other edge of the orbit. Improves cross-paw wrinkles. 3 points, protrusion sigma, less than 2 centimeters for the outer part of the eye. 4 point, nose base. The inoculum points is identified by describing a line that joins the nostril to the trago and then a perpendicular line that starts from the pupil. The points of intersection of the line locates the injection point. At the intersection of the pupillary line and the horizontal line that start from the nasal wing, about 1.5 centimeters beyond the root of the nasogenetic fold. 5 point, stomach 4, about 1 centimeter sideways at the corner of the mouth, improves dry skin, thin lips and facial edema. 6 point, chin, draws a vertical line in the center of the chin and a line perpendicular to a third from the top of the vertical line and therefore about 1.5 centimeters in direction of the lip sides, about 1.5 centimeters outside the center point of the midline of the chin. 7 point, small intestine 99. Upper mouth is located on the depression between the center of the tragus and the mandibular condyle. Improves sensitive and erythrithian skin and sagging skin. 8 point, tragus, 2 centimeters anterior lower than the bottom of the tragus. 9 point, stomach or mandibular angle in front of the corner of the jaw in a depression of the front edge of the masseter muscle. Improves the lips and microcirculation of the cheek. 10 points, large intestine 18, on the anterior edge of the sternocleidomastoid muscle at the upper edge of thyroid cartilage. Improves facial microcirculation. The first technique with Opéra REV by regeneration full face. Protocol, 3 sessions. The first session is 30 December 2020. The second session, 29 December 2020. 3 sessions, 9 January 2021. Including in first and second session, 0.05 ml by 0.1 vial. Last session, 0.1 ml by 0.2 vial. Future Opéra REV, biorevitalization, regeneration, remodeling, superficial subcutaneous tissue, and dermis. This is the practice of the treatment con F.I.R.S.T technique. First sitting, before and after treatment. And this the same of the points, the first technique. This the second sitting for the treatment with the first technique con Opéra REV. And this the third sitting, the first technique with Opéra REV. Start the opera, regenerates the skin with the first technique. Thank you.
Okay, 5 minutes of break, and after we can start with the first patients and the technique.